Primal Strength back here and about to treat my arm. I'm still getting a little tingling in my fingers, and this is something that actually gets reproduced if I get on my forearm tissue. So thinking pronator, flexor digitorum superficialis, the median nerve actually can get entrapped in there. So I'm just going to go through some cupping that I normally do to decompress that tissue. So I'm using just the Rockpods. I'm going to go down that median nerve tract. So getting closer to carpal tunnel too, because could it be a tissue issue where it's getting congested and the tissue's getting caught? So I'm going to go ahead and just put these on along that track. I can even work up a little bit higher if I can get it to stick in the crease of the arm. There we go. And then going in medial arm here. I'm just going to go in and work on each of the pods. So working on tissue glide, getting in all different vectors and trying to get the tissue to glide and move, because maybe it could be an entrapment of a branch of the nerve in the tissue. So for me, cervical, shoulder stuff doesn't really change the symptoms, so I'm starting to go down the chain in here. I can go in and do some nerve glides here, which there's a little neural tension, but could it be a distal entrapment causing it? Oop, we got one popped off. Trip wants it. All right, Trip's got that one. Trip, you're not allowed to chew that. Thank you, bud. Thank you. He's wondering what mom's doing. So, can you mobilize him for me? Go ahead. Right, bud? Thank you. So still doing some more nerve glides while it's on here. And that actually feels pretty good while I have the cups on. There's not much neural tension left as I'm on that, even if I go away from it with my head in there. So that's definitely going to leave a nice little mark because I'm getting decompression with the cups. Also starting a healing process in there with the breaking the little capillaries. So two different mechanisms that are happening in there, actually three. Touching is just bringing awareness to this area, to the brain. So we're getting a neurosensory effect, we're getting a chemical, neurochemical effect, and then we're also getting a mechanical effect with the decompression along there. So if you have any questions for cupping, if you have any questions about pain, reach out to me and we can dig a little bit deeper.